All right, so welcome to Motivation Corner by Super Easy Eggplex. We have Alyssa Miranda, a registered nurse on her way to becoming a nurse practitioner with us. Say hello.
Hi everybody.
All right, so the purpose of this video is just to kind of motivate people and get people to know that they have opportunities to become professionals. So I'll ask you a couple of questions so people know that reaching their goals is actually something that we all can do. All right, so we'll start off with just tell us about yourself and where you're from.
Okay. So my name's Alyssa. I was born in Mass, but I actually moved at a very young age to Vermont, which if any of you know Vermont, you know that it's very rural. There's really not much going on out there. So when I graduated high school, I came back to Mass, and I've been in Mass ever since. And now I live in a smaller town in Mass with my husband and my son.
All right, good. So as far as a career, you chose nursing.
Yes.
What made you choose the nursing field?
So I always knew that I wanted to be a nurse, but nursing or school in general never came like super easy to me. So it took me a while to decide to make the commitment to go back to college. It wasn't until I was a little bit older that I did decide to start applying to nursing school. Definitely growing up, my mom had multiple sclerosis, and both my grandparents were like sick throughout my whole teenage years. And so we spent a lot of the time like in and out of the hospital. And I just kind of knew that the nurses just took control of the patients. They took such good care of my family. I always thought they were just so cool, and they just seemed to always just really know what they were doing. And it made me really look up to them. So I think when I finally chose, a path, it was pretty easy for me just to say, oh yeah, I definitely want to be a nurse.
Yeah, I think like with nursing, that's how it is. A lot of us come across a certain situation that makes us say, this is the right career for me, and I'm going to pursue that career. So that's
Yeah.
good. Like I think that's a thing that we all have in common as nurses, and I'm sure nursing students are also in the same situation where they experience something in their life and then kind of push them towards becoming a nurse or pursuing a career in nursing. So you got your degree in as a RN, and now you're going for basically, I think you graduated already, right? As a nurse
I graduate in a week and a half.
Oh, congrats.
Thanks.
So with that said, your like passion for being a nurse requires that you stay focused. So how do you stay focused? How important is it to stay focused on your goal?
So I think like in healthcare, there's really no opportunity to slack off, because as we all know, healthcare changes by, the day, sometimes by the minute. And if you've taken care of patients, that patient statuses can change by the second. So I think, obviously staying focused is super important, but you get to a point in your nursing career too, where you definitely feel like you want more. Like I feel like I was, first I got my RN through my associate's degree. I really could only get a job out here in Mass, in like long-term care facilities, rehab facilities. So I decided to make the choice to go back to school and get my bachelor's from that. So really you have to stay focused, because if you don't, you're not going to progress in your career. You're going to get stuck. It's important to make goals. It's also important to, work towards those goals, even if it's just one shift. Like if you have 4 patients, you know what you have to do for those 4 patients. And if you lose focus throughout your shift, you're putting your patients at risk. And same thing, if you want to pursue in your career, you have to remain focused. We have it when we work in hospitals, we gain reputations as nurses. Our nurse managers know us. They're going to say, oh yeah, that nurse is on top of her game. She's focused when she's here. Or they're going to say, kind of flaky, always late, whatever. So you just need to, it's important if you ever want to progress as a nurse to remain focused.
Good. And, going through school, you had to study a lot, and you're still studying a lot. Just to you're becoming a nurse practitioner. There's even another level of studying, I'm sure. And in general, I know like a lot of us, I'm sure including yourself, you hit a point where maybe you didn't do too well in an exam, or maybe you had a tough week, something didn't go right. And you probably felt like giving up at some point between getting your associate's degree all the way up to where you are today. You probably felt like at some point you're like, I don't know if I can do this anymore. You probably hit that point. Maybe once you kept it to yourself, but what pushed you to continue?
So I think what pushes me personally to continue is just I wanna be successful. I wanna come home every day from my job and feel satisfied. I wanna know I helped people, and I know that by giving up on myself, that's really not gonna, eventually get me to have that satisfaction, that job satisfaction. I've known I've wanted to be a nurse practitioner for a long time. I took Instead of going right back to school after my bachelor's, I took time off because I didn't think I could do it. I was done studying. And ultimately, when you have a goal, you just have to remain focused. And there have been multiple times throughout my program my nurse practitioner program, where I've just been like, I can't do this anymore. I'm so done. But you take a break, whatever it is for your self-care to regain that motivation. For me, it's just like taking some time off, being with my family, being with my friends, and then Monday morning you get right back into it. And I mean, you just have to keep going.
Yeah. So like mental health, and
Definitely.
just taking that break is really important.
Yeah, taking a break is really important. I was doing not great on my practice boards exams. So I just like took a complete break from doing the practice questions, took a weekend off, like made sure I just did all my work before Friday, took a weekend off, reset my mind, reset like the way I'm thinking about this program, as it's not a hassle. It's, a step for me to reach my goal. And just got back to it. Yeah, definitely self-care, mental health, taking care of yourself, and understanding that we all make mistakes. There's a time where we all don't do great on a test or whatever, and just moving on from it.
Good. It's good that you say that, because on my course I have we give students a schedule, and I just realized we don't give them a break. It's like 7 days a week study. But
which it does, it's great, but just sometimes, like, I think I answered the same question wrong like 10 times. And I was just like, I have such a block. I really just need to reset, because I'm looking at this as a chore, not as like something I want to do to help me reach my goal.
Yeah, true. All right. So to wrap things up, because we want to keep it short and sweet for everyone, so we don't go over too much time. But so the last question would be advice for anyone listening and planning on becoming a better version of themselves. What would you say to them?
I would say that if you want to be a better version of yourself, you have to work on yourself every day. Whether that's studying, whether that is making goals at work, even if it's just 1 minute of brushing up on knowledge that you need, if it's a nap, if it's skipping laundry, whatever it is that makes you progress throughout that day, that's what you need to do. If it's 1 minute a day, if it's 30 minutes a day, I know right now nurses are going through a lot of burnout, like taking that time to reset. Like we talked about already, mental health is so important. I would just say, even if it's just 1 minute a day, make sure that you're at least putting a little bit of time every single day into improving yourself. You don't want to overwhelm yourself and then not get anything completed that day, because then that day is wasted. So whatever you need to do to push forward, and even if it, like I said, just a tiny amount a day, it all adds up and it all counts to allow you to reach your goal.
Good. And then the other thing that I want to add is I want everyone, listening, watching, to know that if you put your mind to something, you can make it happen. So
Oh,
anyone
yeah.
can make it happen. Like you have a kid, you have responsibilities, but yet you've made something happen. Like you actually, you're going to be a nurse practitioner. So
I
for
am.
someone to have excuses, it's almost impossible to say that you can't achieve a goal because there's a lot of us that have a lot going on and we make time. If you have to wake up at 3 a.m, if that's what you have to do, if you have to go to bed at 1 a.m, wake up at 4 a.m, then it's possible. You just have to write it down and I guess have a plan.
You have to do it. I mean, I deleted social media the past few weeks.
Yeah.
Instead of scrolling social media, I pull up my practice test questions and I do that. Yeah, you just have to make time. Whatever amount of time that is each day doesn't really matter as long as you're working towards something every single day. We waste so much time doing things that really don't mean anything. So shifting that time that we're using, wasting time into being proactive and reaching our goals is definitely a really important and good way to get where we want to go.
All right, sounds good. All right, well, thank you, Alyssa. Thanks you for being our first interviewee.
Thank you.
So for everyone watching, this is a new segment that we're trying with our social media pages. So we call it Motivation Corner by Super Easy NCLEX. And hopefully you guys enjoy the content that we're going to be bringing you. We have people just like Alyssa that are highly motivated and are always going to be there to help us out as registered nurses, as nurse practitioners. And anything else you want to add?
No, sign up, take the class. I've heard a ton of really good stuff about Super Easy NCLEX. I wish it was around when I was taking my NCLEX because my class wasn't all that great.
All right, sounds good. Well, thank you, Alyssa.
Thank you guys, or thank you, Dee. Have a good one.
You too, thanks.
Bye.